we're going to talk about disseminated blastomycosis. Definition: blastomycosis is a systemic pyogranulomatous infection usually caused by the inhalation of spores of Blastomyces dermatitis, an organism that lives particularly in moist environments. Clinical presentations vary widely, ranging from an asymptomatic cell-limited pulmonary infection to acute respiratory distress syndrome, a life-threatening disease. Signs and symptoms. Blastomycosis is usually localized to the lungs and may be present with a self-limited flu-like illness with fever, chills, myalgia, headache, and a non-productive cough. An acute illness resembling bacterial pneumonia with high fever, chills, also productive cough, pleuritic chest pain, mucopurulent or purulent sputum, chronic illness with low-grade fever, a productive cough, fatigue, night sweats, and weight loss. Rapidly progressive and severe disease, for example, multilobar pneumonia or ARDS with fever, shortness of breath, tachypnea, hypoxemia, and finally hemodynamic collapse. Extrapulmonary manifestations are present in 25 to 40% of cases and may present with cutaneous lesions, usually either verrucous or ulcerative, and may be asymptomatic. Osteoarticular lesions cause bone or joint pain, soft tissue swelling, possible involvement of any bone, but vertebra and pelvis are common sites. Genitourinary manifestations including prostatitis and epididymitis may be asymptomatic or may cause pain on urinating. Other sites, blastomycosis dermatitis has been reported to involve almost all organs including eye, liver, breast, thyroid, and adrenal gland. Central nervous system involvement, intracranial or epidural abscesses, and meningitis. Now, how is blastomycosis diagnosed? Through exams and tests such as chest CT scan, chest X-ray, skin biopsy, sputum culture, and examination, tissue biopsy, and urine culture. How is blastomycosis treated? Most people with blastomycosis will need treatment with prescription antifungal medication. Itraconazole is a type of antifungal medication that is typically used to treat mild to moderate blastomycosis. Amphotericin B is usually recommended for severe blastomycosis in the lungs or infection that have spread to other parts of the body. Depending on the severity of the infection and the person's immune status, the course of treatment can range from 6 months to 1 year. What is the prognosis for blastomycosis? Is variable. About 50% of infections do not even produce symptoms. Those patients diagnosed and treated appropriately usually have a good outcome, although they need to take medication for many months. Immunosuppressed patients with blastomycosis have outcomes that range from good to poor. Although some may recover completely, the mortality rate is about 29%. It can be high as 40% with patients with AIDS and 68% with ARDS. How can I prevent blastomycosis? Prevention of this is difficult because the fungi are widespread in the USA and many other countries. The CDC recommends that immunocompromised people avoid going to thickly wooded areas where the fungi occur in high numbers. Currently, there are no vaccines available to protect individuals from the fungi that cause blastomycosis. How common is blastomycosis? Overall, blastomycosis is uncommon. Most cases occur in the United States and Canada. In states where blastomycosis is reportable, yearly incident rates are approximately 1 to 2 cases per 100,000 population. Even though in the last 2 decades several cases have been reported in Guayaquil, Quito, Cuenca, and Puerto Viejo, this disease is still rare in our country, Ecuador. In conclusion, despite the fact that this infection can lead to death if it's not treated, it has good outcomes for people who do treat their minor skin sores and relatively mild lung infections.